ఫస్ట్ హాస్పిటల్కి రాగానే ప్రతి పేషెంట్
The first person a patient meets in the hospital is the nurse. In taking care of a patient, a nurse has a bigger role than a doctor.
అనేది
A patient communicates freely, expresses all doubts and difficulties to the nurse initially rather than the doctor.
పేషెంట్ కేర్ ఇవ్వడం.
The role of the nurse is to take care of the patient, to take her or his personal history and to give care.
I like to be with patients. I feel a nurse can touch a life.
This is the service to humanity.
Nursing is such an indispensable part of entire healthcare system. The nursing functionary takes a lot of interest and gives direction to the patient care.
The government of Andhra Pradesh producing about 30,000 nurses. So far we find it very difficult to organize the data in any retrievable manner.
Nurses have to register for getting a work permit with the state nursing councils.
Andhra Pradesh nurses, midwives, auxiliary nurse midwives and Health Visitors Council helps protect the health and safety of the community by promoting high-quality standards for nursing and midwifery education. APNMC, with technical assistance from Project SNEH, strengthening nursing expertise in HIV/AIDS, and in collaboration with the Government of Andhra Pradesh, Directorate of Medical Education and National Informatics Centre, Hyderabad, Government of India, has developed the online registration system for nurses and midwives. NIC Hyderabad has created the software system and it manages the data security.
I have completed my BSc nursing and after that I have to do my registration, which was very much tough for me.
I went there for several times, that is nearly 4 to 5 times. So for registration, I have faced many difficulties.
The initial process for getting an application and filling the details manually, going to bank, get a DD and going to a post office, posting all the details, that registration certificate, it may be reaching the candidate after 15 days only. If online system is done, all this time could be saved.
From their homes or from anywhere there is internet, nurses can access the registration facility 24/7 to upload their details and documents. The system is in use since May 2013. With the online registration system, nurses can easily log in and request for new registration. They can renew their registration and apply for no objection certificates for migration to work in other states.
Keeping the records safe from white ants especially, we are finding it very difficult. With this online system of registration and renewal, giving NOCs and verifications and all, that sort of problem can be removed. So the workload on the limited staff is very heavy. And even for me to do all the thousands, hundreds signatures per day, it is taking so much of my precious time. Otherwise, where I can concentrate on other quality work in relation to nursing education. If online system is done, all this time could be saved and my staff workload can be reduced and I can go for innovations of nursing council quality work.
The Andhra Pradesh Nurses and Midwives Council website provides a one-window access for newly qualified nurses to get registered and for already registered nurses to secure their mandatory renewal. The site seamlessly provides all the required utilities. A candidate applying through this facility can make their payment online or they can pay by demand draft. This is for official purposes only. General instructions are available for easy reference. Furthermore, there are details of proposed plans to enhance infrastructure and to upgrade technology. There is an e-library to help nurses, health workers and midwives. And there's a direct link to the website of the Indian Nursing Council.
everything nowadays becoming online. Okay, so again, I don't want to go to manual process of sending it through post and all those stuff. There is every chance of misplacing or doing something. So online registration in the sense directly they're entering to the website and they're going to key their complete information, and right away it is going to sit in our database. Okay, whenever we want it, we can retract it again, the information also as well.
We need to have live register, which is not there in India in any state, and Andhra Pradesh started this few years back, and now it is getting strengthened with the help of SNEH project. FHI is helping. We will know how many nurses have graduated and ready for employment each year, because every year number of beds are enhanced in the hospitals, and we need to recruit nurses. That requirement we will have an idea. For specialty training also we can plan.
At the higher end, where we have super specialities, we also need super specialities trained nurses. So time has come for our state particularly to improve the caliber of these nurses.
This system totally starts from the time of notification, online application, and their data entry. Each student is identified by a particular number and the data is entered, and anybody right from the nursing council or anybody can access that information. Even they need not come to the institutions to get such information. They need not travel, and the students, institutions and the establishments will definitely be benefited by this computerization.
New technology is improved. We have to update our knowledge and we have to go along with the new changes and the new technology. So better, because why, the student, if she wants, she can get it done wherever she is staying. She no need to come to the Hyderabad city only, where the council is there.
When a candidate applies, she or he clicks on the relevant button and fills out the online form. When the form is filled and submitted, the candidate receives an acknowledgement. The candidate also receives an SMS alert with a reference number. Following this, she or he has to visit the council for physical verification. APNMC will ask for the reference number and verify the certificates and demand draft details. Subsequently, APNMC will issue the nurse or midwifery number and certificate. The forms can also be filled in Telugu if she or he chooses to do so. To get a duplicate receipt, the candidate has to enter the name and date of birth. Nurses can also apply to renew their registration. They receive an acknowledgement. They also receive an SMS alert with a reference number, and they can track their renewal status. APNMC will verify the certificate and demand draft details, and finally will issue the renewal certificate. And on this website, candidates can also apply for no objection certificates. This utility for nurses assures several important functions.
Now I have heard about online registration, which would be very much helpful and benefit for the coming generations.
After this registration also we need to renew 5 years.
Not only the coming generations, but we who have to renew the registration.
It is better to register in online registration.
It will be very much helpful for us.
Online registration is important. We will do this communication with all the nursing colleges, with all the nursing schools, the nursing council in the state, the Directorate of Public Health, the Commissioner of Family Welfare, our Director of Medical Education, all these important functionaries. I think all of them have to send out these messages.
Any research or any developmental activity definitely requires a consolidated data as it is developed with the AP Nursing Council with the help of Center for Disease Control and all CHAI, etc. It's really appreciated. I'm very optimistic this information is going to be of great help in health planning in Andhra Pradesh.
The benefit of online registration enables various agencies to derive a range of reports. The analysis will be useful for all stakeholders of the project to build the country's health infrastructure.
My name is Rupavati from West Godavari district.
For nurses, they can save time, they can save expenses. It's a priceless tool of convenience at one level.
I have registered online in Andhra Pradesh Nursing Council.
At another, it opens possibilities of their reaching out to the wide world, to pursue global careers and to contribute to the image of India.